Hello and welcome to our latest COVID chat. With us is NorthBay Healthcare's Chief Medical Officer, Seth Kaufman, who is also an emergency medicine physician, and he's going to answer questions on COVID today. So if you have a question, type it in the comment and we'll pass it along to the doctor. Thank you, Dr. Kaufman.
Thanks, Robin. Good morning, everybody. So for today, I thought I would start off with some of the numbers in Solano County, talk about NorthBay's COVID numbers also for the first few minutes, as we do during most of these sessions, at the beginning of most of these sessions. And then for my introduction today, I was going to talk a few minutes about testing and all the frustrations around testing and do my best to explain why some tests are faster, why some tests are slower, what NorthBay's trying to do to solve the long lag time for testing, and then we'll go right into your questions. Okay, so for numbers, the current numbers for Solano County, as of yesterday afternoon, 3,884 confirmed cases. We have a 7-day positivity rate of about 6.2%. That's actually a downward trend. We were up in the 10 or 15% range a few weeks ago. You shouldn't be too encouraged by those numbers. Part of why that rate could be dropping could just be delays in test results showing up in the data. So the first thing to know is data is just data, and while we hope that our overall positivity rates, the number of patients that are turning positive, goes down, it is encouraging, but doesn't mean 100% that the real number is not much higher. Our total deaths stand at 38. The vast majority of those deaths is in elderly people. Something around 90% of those deaths are in the elderly population, when they only make up around 10% or less of the population that turned positive. So again, it's a very low. Our older population are very good with their masks and their social distancing and their hand hygiene, and their overall rates of getting sick from COVID are lower, but of course they represent the vast majority of the deaths in Solano County and across the country and the world. Okay, so those are some of our Solano County numbers. Our hospitalization numbers in the county are currently, the active hospitalization numbers are at 42. That's also a downward trend and encouraging. Solano, North Bay is also seeing that ourselves. So we have a dedicated COVID unit, as I've spoken about many times before on these talks, and we had a fairly full unit, and it's been getting better and better. So that's really encouraging. We still have a lot of cases that we're diagnosing every day. We still need to be as vigilant as we can with those transmission precaution interventions, the hand hygiene, the mask wearing, and the social distancing. What's also important, by the way, to keep these numbers low is that if you do test positive for COVID or have symptoms that are consistent with COVID, that you isolate immediately, and you're really, really good in your family, in your household, and in any other environment. You're really good about isolation. Okay. With that, I want to speak a few minutes about testing. Then I'm going to go right into your questions. Testing has been very challenging since the beginning of this pandemic. A lot of it has been related to supply chain issues, the ability for all our labs to meet the demands for testing. It's been a really big challenge. Here at North Bay, we've had a challenge. In the county, we've had a challenge. In the state, we've had a challenge. I'll tell you a quick story. A few weeks ago, I really needed to visit my parents. They're elderly. I have diabetes in my family. No doubt, visiting my parents is a high-risk endeavor. Okay, so I was going to do it in a careful way, but I decided I should get tested ahead of time. I went to a state testing site, and a handful of days before the scheduled time to meet with my parents, and when and it was thought that maybe that test would come back in 3 days, but it took 6 days for me to get the results. It was really frustrating. It was anxiety provoking. One thing is not to have a test out there at all, right? You can decide for yourself, this doesn't even feel like COVID, it's not COVID, I'm not COVID. But if you actually have a pending test, for many of us, it's anxiety provoking. There's a test out there, eventually the result's gonna come back, but you don't know when. So I completely understand the frustrations. It's also not that helpful if the test doesn't come back within a few days. We know the highest risk for transmission is a day or two before you show symptoms, and then quickly drops down within the first day of symptoms, and then gets better and better. If you don't have a test result back within a few days, it really isn't that helpful. If you don't require hospitalization today, there's no good treatment. It's just kind of stay hydrated, right? Try to kind of stay active if you can and wait it out. So honestly, the value of a test is to know, do I need to isolate? If we trust the test result, do I need to isolate? And really, you need to know immediately. So in some ways, if you don't know immediately or within 24, 48 hours, it's not as helpful as it can be. Okay, so with that, let's talk about the different kinds of tests out there and why there's that lag time. The majority of tests done at NorthBay Healthcare in the outpatient setting goes to our one of our big commercial labs who are doing their best to meet demands. I know they are, but most health systems, including ours, don't have control over the amount of time it takes to come back. We try our best, right? And I know our commercial labs are doing their best to prioritize who to test and who to put first for testing and who to put last. But we are experiencing a week, 10 days, sometimes longer turnaround times for those testing. So that is, and every system's going through this, but NorthBay, most of our tests go out to a commercial lab like everybody else, and those commercial labs get just slammed with tests all day long. They have a certain amount of machines, they have a certain amount of staff, they're doing their best, and that's what takes those 7 or 10 days. Okay? The vast majority of the good tests, the PCR tests that are in our commercial labs at UCSF, a lot of these tests take 4, 6, 8, 12 hours to run. So it's not like the test itself on the machine takes 72 hours or a week. It takes a day for a lot of them, the good tests. There are some rapid tests, and we have some here at NorthBay. We have some limited rapid tests. Remember, with rapid tests, some are good and some are not so good. We've spent I spend a lot of my time looking for new opportunities for rapid testing. We have to use our rapid tests for some of our highest risk groups. So here at NorthBay, we use our rapid tests for all our hospital admissions. We also have, for anyone that needs an urgent procedure, we use our rapid tests. So I hope that makes sense to you. Like, we're admitting that patient right there on the spot. We need to use our rapid tests for that population. Our hope is to have a high quality rapid test for anyone that needs a test, but that it's just not available. But I work on that on that every day. Our staff works on that every day. So that's why sometimes you hear about people getting a test back immediately or being tested maybe in the hospital and they get results. And sometimes you hear about people waiting a week or 10 days for those tests to come back. We are making other efforts to get quick turnaround times on those tests. So looking at having a relationship with private labs, so not the big commercial labs, working with other institutions. We continue to look for internal testing that we can use ourselves, where we can have more control over who to test, who not to test, and that turnaround time. That is one of our highest priorities. The other group that we're constantly watching and trying to test is our employees. So we have a process at NorthBay where if an employee has symptoms or has a confirmed exposure, and confirmed exposure, by the way, is a strict definition. Walking by somebody who has COVID is not a confirmed exposure. It requires to get COVID. It's a prolonged exposure, not using not PPE. We worry about family households where somebody is positive. Those kinds of things is how we define a confirmed exposure, and that's using CDC and CDPH definitions. And in an asymptomatic employee who has a confirmed exposure or those with symptoms, we have an expedited process where we can get them tested, we can monitor them, we can support them. So we are constantly watching and trying to help and support our employees. That is so that we can provide to keep them safe and provide care to our community. That is what I have on testing today. Of course, if you have questions, I'm happy to answer any questions about anything, and I know testing is one of the most important ones, so ask away and we'll go from there. All right, Robin, what questions do we have?
Well, we have Chris who's asking a question. Thank you, Chris, for joining the chat. He says he or she says they have a brand new grandbaby and
Congratulations.
a granddaughter, and they want to know what's the safest way to take the new baby to needed places like the grocery store or doctor visits since they can't wear a mask.
That's a really good question. So first and foremost, so let me repeat the question. You have a newborn in the family. Newborns cannot wear masks. What do we do to keep our newborn as safe as possible? So of course, distancing is the best. So nobody, and actually generally that's the rule for newborns period pre-COVID, is not to really have people touching the baby. We don't want that your little one to get sick. Remember, newborns, it takes time for their immune system to become strong. It takes some time. So generally any newborn, pediatrician's advice generally is to keep them fairly isolated, at least physically, from others. But in COVID times, it's even more than that. So your newborn should not be going to the market 100%. It's really indoor environments are the biggest risk, indoor environments. With that, the one exception is if there are necessary appointments with your pediatrician. Those are pretty important, especially at a newborn stage. I will tell you, a lot can be done over video screening. Vaccinations cannot, and there are some exams on newborns that are done at birth. So that's finished. There may be some follow-up exam that's needed. So the first thing to do is call your pediatrician and ask, what are you doing with your newborns? They have newborns all day long. They've had them since the beginning of this pandemic, and they will do some virtual, and you might need to go in for a visit. And then the clinics, our clinics, others have set up really good, strict kind of COVID measures that involve distancing and careful placement of waiting room chairs and things like that. And they will tell you the whole process so that your newborn is safe when you have to come for a clinic visit for like vaccinations or your little one has to have an exam where there's an issue. Okay. Other than that, really, the newborn should be in the house. If people want to visit the little one, backyard, like across the backyard. Let's go more than 6 feet on this one, and that's my advice on that. Good question, Chris.
What about as they get older, when they're 3, 5, 6, 7 months old?
7 months old. That's in term. I think we have to cross that bridge when we get there. What are COVID rates going to be in the next few months? I think probably the same rules are going to hold as they are now. When your little one is 3, especially up to 3 months of age, absolutely no touching other than the parents and whoever has to. And then things may change as your little one gets older. But if COVID remains highly prevalent, or if there's not an effective vaccine in 6 months, probably we'll have to continue that social distancing will be the key. That social distancing will be key.
If you or someone thinks you're sick or you suspect COVID, what do you do? What should you do? Where should you go? Do you come into the hospital? Do you call first? What are the steps?
So the first thing is to call your primary care doctor. That's a good reminder to talk about the different types of testing options here. Number one, there was a time earlier in the pandemic where there was so little testing on these sessions. I would say if you have COVID, just presume it. And if you're healthy and you're not getting sicker, just isolate, don't get others sick, wear a mask. These days, we really need to know who's positive and who's negative, and we're really recommending testing whenever possible. And if that means we need to keep pushing forward, which we are, to try to expand testing options, we need to do that. So there are a few state testing sites on the Solano County Public Health website. You can schedule an appointment. They are hard to come by right now. CVS has testing. And our NorthBay Urgent Care has testing. So the first thing to do is to call your primary care doctor. If you don't have a primary care doctor or you want to be seen by urgent care, just reach out and we'll make an appointment for you. And that's the first step. But my recommendation is if you think you have COVID, pretend you have COVID now, act like it, isolate yourself, and then make an appointment with your doctor. It might be done virtually, and then we can set up a test, or we'll send you to urgent care and do our best to get you tested if we can.
Okay. The state's reporting a data glitch that's affecting statewide statistics, which the state uses in making decisions on opening businesses and so forth.
Correct.
Do you think we're experiencing the same glitch in Solano County numbers, or are those numbers solid?
Yeah, so that is the concern. No, there's a concern that with the delays in the state data, it is affecting our numbers. That's at the beginning of this talk, I mentioned the 6.2% positivity rate, right? We have a lot of tests that we have many tests that are going through the state, and so we are concerned that that some of that drop in the number of cases is this glitch and delay in getting state data. So we should not be confident right now that the drop in numbers is some sign that we're mitigating this pandemic. Nothing should change at this stage. What is a little more encouraging is that our hospitalization rate is dropping across the county, and that's real. That's not a data glitch. But our overall numbers that you see on the public health website, I would say at this stage, and this is coming from our public health officials, this information, at this stage we should be very cautious in trusting those numbers. Let's wait a little bit and see as the state solves the glitch issue whether those numbers are the same.
Okay. We've heard the rapid test results are not as accurate. Are they more commonly false negative or false positive? And if you think the result is wrong, do they recommend a different kind of test?
That's a great question. So the question is tell us about the rapid tests. We've heard they're not as reliable. Does that mean that if I turn positive, it's not real, or if the test shows no COVID, that I may have COVID? So overwhelmingly, the rapid tests, independent of which one you have, some come back, by the way, in 10 minutes, some come back in an hour and a half. So rapid is generally within an hour or two, 10 minutes to an hour, somewhere or an hour or two. Those rapid tests, generally the issue is false negatives, which means that if you have a negative test that says you don't have COVID, you could still have COVID. So we always in medicine, not just about COVID, by the way, always use tests as part of the whole picture. We try not to completely 100% rely on tests for everything. If something looks like COVID and the test is negative, then we do think about a different test if it's a rapid test. So with that, you should know that there's different kinds of rapid tests. There are rapid tests that are better and rapid tests that are worse. It's in the news, right? This is public knowledge that the Abbott ID rapid test has not been shown to have the same level of sensitivity as some of the other types of rapid tests. That's our biggest concern. It still has some value. There was just some comments from experts talking about how the false negative rate for the Abbott might be on the higher side. In other words, it's negative, but you would test positive in their test. But is that because you have less virus in your mouth or nose, and maybe you're not even contagious at that time? Like maybe we only care about those that are positive because there's a high enough viral load to be contagious. And so that's not a confirmed conclusion, but there's still a lot of value to having the rapid test depending on our suspicion for COVID. So it's all about the false negatives. It is absolutely possible to be positive but not really have COVID. And we do have situations at NorthBay and others where we do a rapid test and we decide that we are still concerned about COVID, and we either just treat it like COVID or we do get a second test, one of the slower, longer turnaround time PCR tests. So that's absolutely out there and something you should think about.
You said depending on the viral load. Can you explain what you mean by viral load?
Oh, sure. The amount of virus in your nose and mouth. Lots of tests look at how much virus you have in your nose and mouth, and some of that can correlate to how easily you can transmit it to others. So you have very high viral loads when you're contagious, and then it drops. Now, when people test months out, and it's positive, people think, oh, that must mean I'm still contagious, and it doesn't mean that. It could be me picking up fragments of the virus. There's also some data recently showing that kids have high viral loads but we're not necessarily seeing a lot of transmission in kids. So, it's not, there's no simple answers in COVID or any virus, viral pandemic. Viral load has some correlation depending on whether it's live virus or dead pieces of virus in your nose and mouth to transmission, but there's a lot of nuance there too, where sometimes you could have a high viral load and not be contagious at all. And so viral load, the amount of virus in your nose and mouth.
Okay. What's the false negative rate for non-rapid tests?
What is the false negative rate for non-rapid tests? That is I have to answer that in a different way. So, because it depends on the prevalence in your county. So, Solano County prevalence, we don't even know. Most counties we don't know. So, false negative rates we know are out there, but it's really hard to say a real number. What we talk about instead is sensitivity and specificity. Sensitivity is what are the chances that if I'm if I'm negative, a negative test for sensitivity, that it's really negative. And for most of the PCR tests, it's thought to be north of 80%. So 80, 90% would be great. I don't think we have absolutely confirmed numbers, but the range around there is 80 or 90%. So 85% of the time, let's say, or more, depending, we feel like the negative test is reliable. That might be like, does that mean 15% of the time? That means the false negative rate is 15% of the time? It depends on the prevalence. Like how common is COVID in your area? If you're in Solano, we still don't know completely. Is it 5% of our population? Is it 3% of our population? If you have a very low prevalence, a few months ago when I knew we had a very low prevalence of COVID in Solano County, I could tell you that the false negative rate would be very, very low. If your suspicion is low because it's not very common and you get a negative test, then your negative predictive value it can be very low, so you can trust that negative test. We know prevalence is higher now in Solano County, and so I think it's hard to put a number on it, but here and there there'll be a false negative.
Okay. Is there one symptom of COVID that a person could have that for sure would tell them to get a test? Because a lot of people have so many different symptoms. Mm-hmm. Some are mild and some aren't. Mm-hmm. How do you know when you should get tested?
So the question is are there symptoms that tell you more that it's COVID than others? And there's not one symptom that is a slam dunk. There are ones that are close. Currently, in the summertime when flu is on the rare side, and there are some summer viruses that give people cough and fever, but they're not that common. A fever and a cough together, especially in a higher impact area, and we are on the watch list for in the state, is kind of COVID until proven otherwise. So fever and cough are the biggest ones. Depending on, you can look on the CDC website and others. If you just Google symptom percentage COVID, you'll get a whole bunch of studies, Johns Hopkins, CDC, others, that are showing you studies, and they looked at groups that are positive, confirmed COVID, and what percentage had fever, what percentage had a cough, what percentage had loss of taste or smell, what percentage had diarrhea, and you'll see that cough and fever are the two highest. Fever is like something like 50 or 60%, and I think cough is a little higher, somewhere around there. So that's very high. And you're probably like, that's not high. 50%? That's like a flip of a coin, but that's really high. Diarrhea is in the 20% range or less. Loss of taste or smell a few months ago was quoted as 30%. I think the real number is probably in the 20% range. We've had many patients who thought they had COVID because they lost a taste and smell, but so do sinus infections cause that. And that's people. So we have many patients coming in who have a little cough, little runny nose. We test them. It's negative. We trust that test. And it's really allergies. Claritin takes away their symptoms. So fever and cough would be the highest slam dunk I could offer you. The combination for sure. One or the other, as again, 50%-ish patients have it. Another 50% might have fever. Another 50% might have cough. So one or the other, again, is not a slam dunk. The combination for sure is a slam dunk. And of course, as you add more symptoms, it becomes clear that it's COVID.
So the message is consistently out there to wear a mask and to socially distance. Why can't you just do one or the other? And what do you say to people saying, no, it bothers my face, or my nose itches, or it's breaking my skin out, or whatever?
Yeah, this is the question is mask, or why does it have to be mask and social distancing? Why can't it be mask or social distancing? And I hear you loud and clear. I'll start by saying that we're all in the same situation. Actually, in my lifetime, it's the first time that the world has been in the same situation, at least in my lifetime, and I think probably many for you on the phone, and for you that are older, that have been through some world wars and other things, it's probably not. But mask wearing is challenging for all of us. I do not like it. And the situation is this. I don't think we know enough to say mask or social distancing at this stage. It's true, if you're really far away from somebody, remember, let me start over with that. If you're wearing a mask, the going theories, and I think they're pretty well established now, is that you're wearing a mask to avoid giving others COVID. If you are an asymptomatic shedder, so that you have it but you don't know it. I would say there's also a decent amount of, also I think you could be avoiding getting it by wearing a mask. For sure, a shield also can do that. In other words, if you're not getting stuff, sprays of people coughing or when they're singing, they're spraying on your face or mouth or nose, are you avoiding getting COVID? And I think that's true. I think the data is still out there and there's still people studying this, but I think both it avoids you giving it to others and it has some value in you not getting it. So with that, then hey, but if I just stay away from everybody, can I avoid wearing a mask? And the answer is that it's impossible to stay away from everybody. If you're in your household and you don't have to isolate or quarantine away from others in your household, you have to have your family, then you don't need to wear a mask in your household. You also, that's not possible. But when you're out and about, you can't control what others are doing, and over again we see that. So the answer is that you're keeping others safe and probably yourself safe by wearing a mask out of your house, wearing a mask in the workplace, where again you don't have control over what others are doing. I also will say that while this is a mostly droplet disease, there are some isolated situations where it's aerosolizing, it's floating, it's staying up in the air. And while we feel 6 feet is safe, there could be some situations where 6 feet are not safe. So the best thing to do is wear a mask so that if something is floating out there, you're not getting it and you're not giving it.
Great. How safe are we at outdoor eating establishments? Can't really wear a mask when you're eating.
Yeah, so outdoor eating establishments is difficult. It depends on the location. I'll tell you that the majority of infections that we see are not related to outdoors. They're related to indoors, not great ventilation, close quarters, people not following the mask wearing and social distancing and hand hygiene rules. So outdoors is much safer, period. Outdoors is much safer, period. The beach, the park, things like that. If you're sitting at a table, I'll say one more thing before I directly answer the question about outdoor eating. It is also well known that eating itself does cause saliva, mucus to kind of fly around. So if you're eating across from somebody who's not part of your closed loop, and of course you're not wearing masks, you're eating, you are spreading whatever's in your mouth. And that's probably gross to think about, and now I'm going to think about that all day long.
Some people more than others, maybe? I
guess some people more than others, but eating is a concern. So with that, if you're eating outdoors with your closed loop, it's your family that you live with, nobody has COVID and is isolating in the bedroom kind of thing, then that's the first thing to think about. Am I safe at the table? Then are the tables spread out enough where you are not getting anything from anyone else? And then of course the service staff who I know are being monitored closely by their employer, and we have regulations in the state and the county to really make sure the servers are being good about mask and hand hygiene and trying to separate themselves. Are they doing their best to not transmit anything to you? So honestly, it's case by case basis in terms of those outdoor eating, and it's a little bit of how comfortable you feel, and in some ways your risk tolerance. But outdoor is much safer than indoor. Spacing of tables, who are you with at the table, and is the staff being as careful as they can be?
All right, and Kathy is submitting some questions, and thank you, Kathy. These are kind of related.
Kathy.
How easy can you contract COVID through your eyes, and should we have our eyes protected when we're out in public?
I see. That's a good question. I'm not sure there's any data on direct eye only. And if you have it, by the way, send it my way. That would require a group who didn't wear eyewear, were mask only, and then looking at what their prevalence rate is of COVID. So I'm not aware of data on eye only, without having being unmasked or things like that. And then it's hard to know, did you get it through the eye or did you get it through the mouth? With that, definitely the concern is aerosolization when it comes to the eye. We know there's ACE receptors in the eye, which means those are the COVID receptors. We know COVID can go into the eye. The question is it enough of a load to get you sick? And is it through air like floating, where really the majority of that concern is in hospital settings where there's procedures and we're doing things in the mouth. People are very sick, and we know that there's aerosolization of COVID, or is it a concern out in the public where there's a lot less of that, and I think it's unknown. But I'm sure we'll have data on it soon. Good question.
We're almost out of time, but I did want us to go over again because hospitals are seeing it everywhere. People afraid to come in to facilities to get the care that they need. Can you talk about how safe we are and why you shouldn't let fear of COVID keep you from getting the medical care you need?
Yeah, so that last question is about, tell us what's happening in the hospitals and the clinics to make sure that when anyone needs to seek care, whether it's a routine visit for vaccinations, a reminder, school season is starting, and I know you're like, what are you talking about? We're not opening schools and going there live. It may happen, and we should make sure our kids are vaccinated and ready, and that cannot be done through a screen. I wish it could be, but it can't be. So routine visits like that, or urgent care needs, or God forbid you need the ER or get hospitalized. Is it safe to come to our facilities? Nothing has changed in terms of the safety of coming to a healthcare facility, coming to NorthBay. We know COVID. We knew a long time ago COVID was going to spread. We were trying to do our best to avoid it, but we've been preparing for this surge since before there was the surge. And so coming to NorthBay is very safe. We have a dedicated COVID unit. We don't mix our COVID positive patients in the hospital with those without COVID. We have mandatory visitor restrictions, mandatory employee rules on masking, and we do have eyewear rules since the CDPH put out, California Department of Public Health put out guidelines around eyewear. We have instituted that, and so we have a lot of rules around that. We do monitor any visitors that are coming are checked on their arrival at NorthBay. Our clinics and urgent care have set up really good processes to keep people as safe as possible. Mask wearing, right? We're trying to minimize wait times. We're trying to keep people separated. Things are done in closed doors, things like that really do avoid transmission. And we are constantly looking at, constantly watching for any sign that there's any transmission in our healthcare environment. And it is very safe coming to NorthBay. Very safe coming to NorthBay. So if you need care, please come. Let us help you. Call if you're looking for for a clinic visit. Start with a call. Maybe it's something that can be done over the screen versus coming in. Patients are coming in if they need to, and we're here to help. On that note, we're going to end it for today. Our next chat will be Thursday, August 20th. Thursday, August 20th, 10 a.m. I'll be here. I'll start with a few minute introduction about some of the hottest topics out there, and then we'll go right into your questions. Thanks for joining.
Thank you all.